Hello again, everyone. You're joining us for a very special episode of Executive Platform's Blueprint podcast series. We are doing a speaker roundtable series episode here at the Biomanufacturing World Summit 2023 in San Diego. We are so pleased to have this roundtable put together with some of the best speakers on the speaker faculty this year. Here is that conversation. Enjoy.
All right, let's get started. So there was a start to the conference yesterday that put several topics on the table. Some of them we dug into a little further, others we didn't. But I'd be curious to hear your starting perspectives on what you are seeing when it comes to talent in the industry right now with all of the changes that are taking place elsewhere. Why don't we start with you?
I'm seeing a deep curiosity in my more scientifically minded regulatory and quality professionals that are just very much intrigued by the explosion of science and the new modalities and just want to get out there and learn. And it's almost like going back to university for some of them, and you're seeing that excitement and energy, and they feel like this is just an amazing time to be in the industry and to be a part of it. I see some folks who are a little nervous who come from more traditional, like small molecule backgrounds, saying this is a lot for me to learn. You know, I don't know sterile manufacturing. I don't know some of these associated techniques, and kind of how do we upskill and transition to the new skills that are required for the future. So it's a mix. I think new people coming in from other companies, we're seeing a lot more mix of like smaller company people coming into the larger company as well because of the modalities.
That's interesting. What are you seeing?
I was going to build on a little bit of that because I came from a larger company. I'm in a small company, and actually I think now in a small company I see our team members having to get more used to change than what they did in the past. In the past it was, you know, somewhat looking back, steady state, and now there's so much change and opportunities with that change. So change for people to move into different roles or different functions, which is really exciting, but also some of that anxiety because the biotech sector is down a little, as you know, Pascal, and therefore there's this anxiety about, you know, what the future might hold. So strengthening their skill set is even more important.
Fair.
Yeah, I would definitely build on that, Anya. I think there's a keen interest in learning across, especially the younger generations coming in, for sure. And I guess, you know, when I think about talent, I think some of the challenges for us is that, you know, there's been such an explosion in the biotech space that I think we're having a hard time keeping up with some of the, you know, more seasoned, experienced, and how are we bringing the next generation up? I would also say that I think that there's really maybe a bit of a challenge coming in the entry-level pipelines, and I think that we've got to be doing a lot better to really create the pathways and encourage people to be coming in.
That's fair.
Really good question and very good answer. So let's see. I think what we are seeing is that people are coming to us and asking questions. Are you working on the new modalities, the new things? Because it's really much about wanting to learn new things.
Absolutely.
That was like pulling people in. Is like, do I have a chance to learn about the new things? Secondly, I think in the younger workforce, as you mentioned, we see questions around like, okay, where's your sustainability agenda? How are like company values? What's the balance in terms of work-life balance? That kind of questions. And I think for many of them, or call it entry level or a bit earlier on into their career, for them it's like almost like okay, if I don't buy into your values or what you do in sustainability, I'm not going to work for you. I think what we see at least is we need to provide that whole package. It's not only about like, okay, how fast can I progress my career? That is like almost like a tertiary kind of discussion. It's more like, okay, do I really want to work for you? That's, I think, what we are
seeing the same generational differences. I think newer employees in the workforce, I think even Gen Z and even a little bit into some of the millennials, I think the expectation is the company's values match theirs and the person they work for. They want to feel like there's an empathetic, understanding human being who wants to help them have work as part of a full life that matches their values rather than just how can I build my career and become a senior leader. It's very different. And as you said, the environmental, how the company stands up on social issues and political issues. And they want to work for leaders that they feel like are a match to where they want to commit.
Or maybe send their puppies flowers, Pascal?
Yeah.
Isn't that an experience you talked about
Out of
yesterday?
context,
I haven't done that yet.
That was a real story. Being essentially, it was a reproach. You like last year you were taking care of me and my close ones and my dog when he got sick.
Super lovers, you
Like
said.
super lovers. We
Yeah.
were, and now we're just back to having to be. I shouldn't say that. Business performance is back as a priority, but we can't abandon our talent completely because some of them expect us to be the same.
And then you layer in this back to work
Yes.
topic and how much people want to come into the office, how effective they are remotely.
Yeah.
And there's a generational difference. So if you're in New York and you're single in an apartment, you absolutely want to come into the office.
Absolutely.
Yeah.
If you're at a manufacturing plant, there's no place for you if you're not in the office. So there's lots of different scenarios, and I think flexibility is key. Understanding what people want and need, but having an employer who's able to be clear about the expectations, knowing that there has to be, that flexibility ultimately.
Yeah, I think you asked a question like, what are we seeing in our talent? I think what are we seeing in them expecting of leadership? I think we're seeing a lot of changes there. I do think some of the skills that were valued during the pandemic, like empathy, like interest and curiosity about the whole person, and just some of the little like tactics, like we did a lot with in my company on like, are you okay? Like checking in on people, and we're using that like during these times of political unrest when we know some people may have some particular challenges in regions of the country or regions of the world where there's strife. Like those skills and tools of the leaders are kind of redefining, I think, what people are looking for in leadership, and it's a little bit less traditional.
We'll get back, actually. This is a question I have for you all, the geopolitical impacts on your supply chain and your business. But just before we go there, I'd be curious, just to finish on the talent segment, what are you finding to be the hardest in the way you are changing as a leader right now? What's least comfortable for you as a leader in this changing world right now? Let's start with you, Diane.
It comes rolls right off my tongue. It's dealing with the generations in the workforce, and frankly, it's feeling old. And it's that, there's almost a constant kind of check in my mind of like making sure that I'm trying to be relevant. And I'm so much more conscious of this now than I ever have been before, because I think because we are seeing this great mix of younger generations coming in, but I am really feeling like the 4 generations in the workplace right now. I really see it on a daily basis, and so it's really interesting. It's definitely creating some new circuits in my brain and new pathways, which is healthy.
Oh, certainly. Per, what do you?
I think it's the biggest challenge for me, which is about, I think we have already discussed, which is to ensure I spend enough time on the softer things because it's so much going on, and the pressure like to move all the new things forward. It's very easy to like, okay, the things we did 2 years ago in the pandemic, okay, it's not like mission critical, but it is really mission critical because otherwise people don't want to work for you. So it's like, make sure I like, okay, remember those things. At the same time, we do all that, as you said, moving more to like a business performance type of environment. Or it's always been there, but I think that's the biggest challenge for me.
I think we cannot stop ever building trust. And Pascal, I feel I get tested every single day. You're asked questions that are uncomfortable. You have to be able to be really clear in your communication about a particular situation. You're asked in many which ways. And over communicating can't be understated. And there's many different ways that we have to communicate. It's not just standing at an all hands. It's the emails or the texts or the weekly newsletters. All the dimensions, and considering that they're all fundamental to building that trust with the cross section of employees, not just your direct reports.
But I think if I can build on that, I think coming back to what we said is that one thing at least I think is challenging for me is all the channels you're expected to communicate through. Because otherwise, if you just do emails, then the younger generation in the workforce like, who reads the emails? I want you to do Teams or whatever. And they're like, okay, I'm keeping up with all of this. It's like sometimes I'm like, I think that's for me, it's a challenge. It's not like I can't do it, but it's like how many channels am I going to push communication through and still do the old school talking to people, calling people. Sometimes I tell my team, you remember that smartphone, you can still talk through it. It's like people are texting and sitting like in the next like 2 desks from each other, and they're like teamsing each other.
We started this Let's Talk weekly session, where people sign up. across the organization. Pick a theme or a topic that's maybe just relevant or topical. And because it's so informal, it actually has helped a lot with that trust building. And again, you're just constantly trying to recreate, listen to feedback, and respond as quickly as possible.
Yeah.
As a leader?
I think one of the things that I'm working on right now is this balance between really valuing people with like the deep expertise in my organization who've learned a lot of things by being in and around the industry, but also wanting to bring in new talent with skills, for example, in digital AI, just looking at things differently that have, it's more the generational skill set. So where do you kind of take a risk on somebody that doesn't have the background and skill set, and where is it that you need these deeply skilled? And even the cross-training of people who are traditionally small molecule into the larger, newer modalities. And so it's that balance between wanting to rotate and cross-train, but also knowing there are places where you need that deep functional expertise. So I'm playing with that a little bit and trying to take more risks in who I'm bringing into some roles.
Do you feel that you can apply the same leadership style with your more technical team than with the rest of your team? Are you the same leader?
I think I am. I do try to play to people's strengths a lot, so I definitely probably tailor what I talk about and what I try to bring out in people. But I think generally if people talk about my style and how I interact, it would be the same notes. But I would say I will try to look for ways to bring out people's strengths and play to those, especially just making a diverse team around different problems.
Interesting. Gotcha.
I was just thinking of one thing to add, Pascal, that I feel like I'm also spending a lot of time on is almost more listening to tailor and provide context. Because there's so much uncertainty right now that people are facing, whether it's internal to the job, externally, that it's really trying to kind of have the radar screen up and listen in order to help provide context when I'm speaking back out, and especially providing updates of where we are as a company and where we're going for people.
Context is king.
Yeah, absolutely.
It is.
I think it's one of the best things, like a gift we can give to our organizations as leaders, right? Is trying to contextualize all that they may be hearing from other sources.
Right.
And as you said, listening for where there may be need to provide additional context and background to allow them to make their own decisions back on their jobs. But that's a really important role. Yeah.
And getting to know people, actually really truly getting to know people is key to knowing what they need in terms of that context.
Right.
And we're not taught how to do that. And people come into our workforces and we train them in all sorts of things, even leadership development, but not that intuition that actually is so powerful as we're trying to help them
Impossible
navigate.
to do on Zoom.
Yeah,
Or
exactly.
Teams.
Yeah.
And it's very easy not to give yourself enough time to do that.
Yeah.
I think that's what my struggle is like. Okay,
Yes.
Yeah.
give yourself enough time to sit down,
Yeah.
just talk to people for 15 minutes, and try to understand what motivates them, what drives them, but also a bit about what's your family situation, what's going on in your life.
Right.
Yeah.
Right.
On good segue to the whole change dynamics, and the context to my question to you is this: roughly 6 years ago, we were on the 10th year of continuous global economical growth with relatively stable government economies, both domestic and global, supply chains, science in terms of its evolution was constant, but no nuclear level change to science and discovery, if you wish, at some levels, etc. And we wrote a series of papers because it was the first time that we had 10 consecutive years of stability in growth across almost everything. And we called them, which was very motivating, they were called the downturn papers, we called them. And the thesis behind the papers was, it can't last. It's inevitable. Are you ready? We don't know what it's going to be. And we were thinking in those papers, we were thinking, so we interviewed roughly 2,500 leaders around the world, and we were asking, we don't know if it's going to be some bank collapses and has a domino effect. We don't know if it's going to be a war somewhere. We don't know if it never thought of the pandemic. But we were asking people, and essentially everyone was saying, 91% were saying, it's coming, we know it's coming. And something like 17% said, we're ready, whatever the change is. We have plan B, plan C, plan D in place for our supply chains. Then the pandemic hit, and then post-pandemic, We're facing geopolitical struggles. We're facing valuations in the biotech industry suddenly collapsed. And it takes longer than we thought to get to whatever. And we're having even in technology, ChatGPT coming in that could, ChatGPT, AI in general could really upend quickly how we do things. So what's your equation management when it comes to, not just as a leader, but in general, facing all of that change? What are you doing to help?
When you were speaking about the downturn papers, I was thinking about, we in my company, we had a pretty significant cyber event about, I don't know, 6 years ago. And I think on the heels of that, we did a lot of work on like supply chain resilience, Plan B, Plan C, Plan D, and we worked through a lot with, different potential international conflicts that could rise up, really galvanizing against another cyber event. But nobody predicted a global pandemic, right? It's the only time in my life that I can ever remember everybody in the world all suffering through the exact same thing, right? And that's what was so unique. Like when we had like 9/11 in the U.S., everybody in the U.S. was going through that, and other countries were caring, but it was differently felt. Here we had something that everybody in the world was going through, and there was no place you could turn that was unperturbed by the dynamics. And so the supply chain resilience, and then the impact of the explosion of the vaccines that became available, thankfully, to the world, all the component shortages, because everything was going to supply the vaccines for the very right reasons. All the spare capacity was going to vaccines, all the components. And so you found things that, here we are still making life-saving medicines like cancer therapies and such, but maybe not being able to get the components you need to make them. And so I think it was a tremendous experience to look back at all that was learned. I think the need for agility, for backup sources, how to communicate and connect really quickly to get people together to make decisions, no matter what the crisis is. Like, how do you quickly get a crisis management team together to make those decisions? To me, those were some of the things, if I think about this period of time where we've had more crises that we've worked through, where we've definitely developed a lot more skill sets and tools to do that.
Interesting.
I think we've become so resilient. So if I go back to, maybe that 2016 when those papers were written, Pascal, it was, there were small issues and small crises. I don't think anyone was fully ready, but I have to say I was so impressed with how quickly we mobilized to just be ready for this situation and continue to be able to support our teams, our patients, our families. I don't think anyone would have predicted back then that response could have been as quick as it was. And then the Pfizer vaccine, the Moderna vaccine, the antibodies, the speed at which they came through was unprecedented.
Yeah.
And now I think we're somewhat. It's fast. It's easy. We forgot about some of the ways in which we triggered some of those responses. But I have to say, I feel like we've become a little bit more parochial in our countries since then, and we're kind of, regressing back. Of course, we've got lots of the geopolitical issues that's driving some of that. But I think it just reminds me in general that life is it's a cycle and a wave, and whatever hits us, we'll respond. But sometimes our memory isn't as strong as we want it to be.
Yeah.
For our own safety.
Yes.
Sometimes, even at some levels.
Yeah. Well, representing a small pre-commercial stage company, I would say our supply chains aren't as complex as, some of the big pharmas. So we probably haven't, thankfully, been as impacted with some of the supply chain disruptions and things. But what I guess for me, what I would say is that I think it's really shined a light on the importance of our supply chain colleagues. And I feel like in the past, they may have been sort of an underappreciated organization that, they were able to reliably deliver, and we didn't think much about it. Now we think about it all the time. And I think I have a new appreciation for the disciplines and what they're doing, for the planning that they're doing. But I've also really come to appreciate how strongly they have relationships. And when you see them with that ability to turn on a dime and they pick up the phone, and a lot of times they're getting things done on the basis of these trusted relationships. We've heard some of that in the meeting this week
Yeah.
too.
Yeah.
Those trusted relationships that they go to and the value that's bringing to the company. And I'm glad that they're being more valued and more appreciated.
You know, sometimes, sorry, Jen.
No, go ahead.
I was just going to say, sometimes we think that technology and AI is going to solve that
Yeah.
problem.
Yeah.
But you're
It's
absolutely right. It's
relationships.
the relationships
Yeah.
in the end of the day.
I agree with you. I was just, when you were speaking, I was thinking about a decade ago, we used to call it distributional logistics. The distributional logistics
Just is.
people. Now it's supply chain strategy, right? And as you said,
Right.
it's really
Right.
brought up the role that they play and the relationships they have and the providers that they work with. It's really elevated the sophistication and appreciation for the work they do. When before it was just, once we do all the hard stuff of making it, they just move it around the world, right?
Yeah.
Now it's,
Right.
you know,
Yeah.
I mean, how about when there was the issue in the Suez Canal, the blockage, like, you know, and what supply chains quickly did to figure out how do you move and figure out where your shipments are.
Yeah.
And like some of the sophisticated tools they had of mapping, like there is the boat with our things. Like if it turns now, we have time. Like I mean, it was unbelievable.
Back to basics.
Yeah,
Yeah.
absolutely. But again, definitely more of an appreciation for the importance of that partnership.
And I don't think that risk management has never been more important. We need to do all these plans, but I think, as you said, the pandemic showed us things can happen that your plan will not cover for, and then I think everything falls back on leadership. So if you think about our company, we actually stepped in and said we're going to do a vaccine for the world, and we have a very limited vaccine business. We produce like 20 million doses a year. In 1 year, we produced 3.2 billion doses, which is a bit crazy, to be honest. But what managed to do that was like leadership, just leadership from CEO, chairman, all the way through the organization, and keeping calm. And you asked me what was the biggest thing that we did as leaders? Keep calm. Keep calm, protect your people, let your people do their thing.
Believe in them.
Believe in them.
Yeah.
And when things go a bit not as planned, talk about what are we going to do, look forward. I think that then you can move mountains.
Absolutely.
In the context of, we could use the pandemic, but it's we've talked about it so much that we could use the current geopolitical situation where for different reasons in different regions and even domestically, it could be concerning to observe the polarization that is allowed now and normalized, in fact, in the media and in day-to-day life. Your enemy is the person from the other party. It's kind of really strange from 10 years ago when you think about it. But so in the context of that necessary added agility in the supply chain, CMOs and CDMOs were not always there and at the level at which they operate today. And it feels a little bit like, for the pandemic at least, the available capacity, a lot of it came from the CMO providers, and then everybody else pitched in whenever possible, obviously. What do you think is the future of the mix between internally made and externally made? What's your views on where that external partner supply chain partnership is going?
I think there will always be a place for both. I think we have played with having fully outsourced some part of our business, fully our own and other parts. I think there are a sweet spot. But however, I think going forward, what we will have to see is a different type of partnership.
I agree.
I think this traditional cut the PO, send it to them, they produce, and back comes the stuff. Very transactional. It does not really work in the new environment because it's so, things are changing so rapidly.
That's right.
So if you try to buy a slot 5 weeks from now, do I need it or don't I need it?
Yes.
So I think we just need to move it much more into true partnerships. And I think the CMOs, CDMOs that are willing to move in that space, and the pharma or whatever biotech companies that are willing to move from their side into that space, that will be the most successful ones. And you also, if you think about the sustainability aspect, if you are a company with a very clearly stated, ambition in the sustainability space, you need your partners or everyone in the supply chain to be on the same path as you. So I think partnership is key.
So Lars actually just built on this topic in his session prior to this, and the importance for him and his company Fuji in that transparency between partner and the CDMO, and the magnitude of investment that needs to be made in order to support partners, and GLP-1 was the one example. is such that there's no way that that amount of investment could happen without that real strong trust and partnership.
Yeah, I'll build. I have a very similar viewpoint that there's a place for each. I think in addition to the environmental sustainability match, the quality and compliance match is really key, because if something goes wrong at one of your CMOs and you are the manufacturing authorization holder, that can disrupt the entire product launch, the entire supply. And so that's probably one of the most critical things to us as somebody who shares that quality and compliance mindset and treats the partnership as one where we're integrated together to kind of be successful. So there's an interesting balance there, right? There's only probably a few that you can do that with, so you're more likely to want to do that with bigger, capable firms. However, the smaller ones are probably the ones who are more likely to be flexible when it comes to capacity and such. And so I do think that it has to, you have to, for us, considering the life cycle of the product and whether we're internal or external for example, launch and the knowledge build versus kind of the stabilization versus, perhaps the decline of the product, and, where should the product be in the life cycle, and who are the right partners for that, and then how do we contract capacity to allow flexibility and agility, because this take or pay, like locking into an annual production schedule, it just doesn't work with today's world. And so we have to be willing to open and share like our forecasts, and they have to share their, that's going to require a lot deeper sharing and trust and relationships, and how many can you take on and do in that way?
Could it be, do you think there's been an evolution of trust between my provider and myself?
Yeah.
Could it be an evolution of trust between my provider, myself, and my peers and their peers? Because if you truly want to maximize I guess minimize the potential negative impacts on sustainability by having 500 too many plants out there, if the whole industry worked together in an integrated fashion, impossible. I know I'm being an idealist, but do you see a path where there could be collaboration?
I think it's already happening, to be honest. If I look at my part of the business, we manufacture for many other pretty big pharma or biopharma companies, and the opposite is happening. I think now with all the different alliances and partnerships, where I think you can't look at any of the bigger companies, they have tens of different partnerships. So it's already happening. I think more to be done sometimes on the transparency, but of course there are also antitrust legislations to be a bit careful with, but much more I think we need, because as you say, there are just very few really big partners you can work with.
Right.
When you run out of those partners, who do you work with?
Exactly.
It's
Yeah,
other companies.
I don't know that. So I think as an innovator company, you can see that sharing of capacity, etc. But I think the CDMOs are not willing to open up their capacity to a number of people at the same time. And we've been there. In fact, we've had 2 separate company conversations with the CDMO, and we had agreed outside, but they, the CDMO was the supplier of the materials, was not willing to open up, for the benefit of both.
We have actually managed
work to do.
We have actually managed to have 3-party discussions with some of them.
Oh,
Yes,
wow.
I would have hoped for that.
Yeah, no, we have managed a couple of times to
That's
have that.
excellent.
It's been working, but in many other cases, absolutely, there's like no interest whatsoever.
The one of the so far at the conference, one of the moments where there was the biggest gasp or like the woo in the room was when someone brought up the commercialization of ATMPs, and how is that? How are we going to have to adjust everything from supply chain perspective? What are your thoughts? Educate me. You tell me. I have no idea how this is going to be achievable in a profitable manner. How are we going to do it? Who wants to start with that? I want to point a finger because this is a tough question.
This is a tough one.
Are we there yet, where we can seriously talk about commercial stage? For some products we are, but
Relative to the number of products that are approved, I mean, it really is, in some ways disappointing that we're not further along. A topic we've talked about a lot internally, and I know at prior meetings, is just how diverse these platforms are, and these modalities are. And until we get to a place where there's more standardization and more simplification, it's hard to imagine that we're going to have a wholesale change to that.
No, I agree, and I think you need also looking at like the automation. It's still very, very manual. Like when you are cracking the whole automation, digitization of the whole supply chain, but also I think the whole market space needs to mature. If you talk about what has been talked about today, which is okay, how do you get hold of the plasmids? How do you get, your vectors? And I think someone shared that I think of their COGS, more than 50%, 50-60% was just the materials.
Yeah.
Then you have a very little chunk to play with if you think that the materials are more or less set. So until that market also become more mature, you have more to more players that actually competing and drive down the cost. I think it will be very difficult.
When we think of the valuations demise or crash of 16 months ago, at this conference back then, we were describing how there was at the time, I believe, 1,350 cell and gene companies around the world, of which roughly 480 were building their own plants.
Wow.
Is that what you're referring to when you say there's just too many platforms and not enough standards?
Yeah, exactly. In the 90s, when we just had monoclonal antibodies, we had Lonza and BI, right? They had a standard platform.
That's right.
We all copied it. And we are successful. Now, granted, everyone was focused then on one modality, one platform, everybody. Now it's just spread out, but it sometimes feels like we're not reaping the lessons from those special days when we had such simpler platforms.
It feels a little bit still like we are at the that stage when you remember when we had those cell phones that was like the size of a big big brick.
The bag phones.
The bag phones.
Yeah.
Like,
Yeah.
you had to have it,
Yeah.
and very few people had them, and it was a product that was. It didn't truly completely make sense commercially unless you were military operations or something. And then eventually the manufacturing technologies evolved and then allowed for more.
Do you remember your first BlackBerry?
As a Canadian, I do remember, and I still sometimes
You still have
try to type with my thumbs. But
I'm giggling. You said the military operations that wanted the bag phone. My elementary school teacher mother had a bag phone, and I was like, "What do you need this for in your life?" But it was so novel, right? She's like, well, "I can bring a phone with me."
it's a big deal.
My father had one. He worked for Ericsson. We
Yeah.
were like their
Oh,
first.
yeah.
You were like the
going on?
prototype.
Yeah.
Yeah, those and they were heavy too.
They were.
They were.
Yeah.
We're completely off topic.
Anyway,
Congratulations.
innovation.
Innovation.
And now
Innovation.
it's this.
Yeah.
So is there? I was remember when I brought up someone asked a question about knowledge management yesterday in the conference, and I was explaining how what I was trying to not say is that there is that song by U2 called 11 O'Clock TikTok, if you don't know it, and there's a lyrics in there where they say or they sing, we thought we had the answers. It was the questions we had wrong. That's how it feels a little bit right now. Like everything about knowledge management, I think we could find a way to be so much better at it today. But I wonder if in 6 months and 12 months, when the first BlackBerry level innovation in AI comes, will knowledge management be different?
I mean, to me, somebody when we were talking about this yesterday in the audience, I thought gave a really good, like, classical definition of knowledge management. Right? It's taking data to information to knowledge that people can use. And I think classically, the way that's been addressed is figuring out how to file things in places where it could be accessed. With AI, it really doesn't matter where things are. You can ask the question and just pull it into a useful way. So to me, it just turns it on its head and opens up so many possibilities. And now it comes down to, I think, the questions that we're grappling with this is like, great, we don't have to feel like how we index this information, because that's really difficult to get everybody to align on and to actually sustain. But now, question really is, you don't want to get false output. So what information are you opening up your realm to pull from? And so we're experimenting with, in our company, with kind of ring-fenced applications just with our own internal documents, and we also have some external stuff too, but that would be used more not for scientific or GMP type of purposes. But I think it's tremendously interesting, even just playing with it for things like, hey, can you summarize these guidances from around the world? What are the differences? And it's not going to be perfect, but you give that to one of your experts, it's saving them a ton of time. They can top and tail that thing and use it, right? And so I think that's the efficiency aspect of it, and making our workers' lives more enjoyable, more, they're going to be more powerful because they can pull that data. I think the next step is like, how do we actually use that to be much more predictive, or to point out insights we wouldn't have had? And so away from the efficiency and more in like the art of the possible. And I think that's how it's being used like in R&D discovery in my company right now, but in the CMC areas, it's mostly around this kind of search and find. And anyways, it's to me, knowledge management, like the future of knowledge management is going to be so different, so much more integrated with AI and IT, and it's very exciting because the volumes that you can get your arms around.
And do you think it's going to enable delivery of those more complex medicines to patients?
So I do think in the R&D discovery, we are seeing some pretty interesting things with respect to pointing out similarities and trends and opening up ideas of what could be biologically relevant. I think in my area, I'm in the CMC space between research and manufacturing. I think it largely is around pulling the insights and information together in a much better, faster, more technology-enabled way. And that allows our workforce to free up their brains to be working more strategically, collaborating, strategizing. And so I think in that way, like, we should be able to be strategizing our regulatory strategy with the other partner areas, and what clinical trials should we be running, and what data do we need. So hopefully they're doing that instead of cutting and pasting INDs that need to be filed, because the data tables aren't in the right format for all the countries around the world. So I think it's it depends on where you do your work, but I do think there's tremendous potential across the board here.
In radiology, in diagnostics of some cancers,
imaging,
in imaging analysis, there are
hugely powerful
leading influencers. The top 3 radiologists in the U.S. are saying 17% better.
Yeah,
we're saving lives. It's irresponsible today to not use those tools because we can't humanly see everything that this is seeing. So,
it's amazing.
But it's all about the question you ask, right?
It is.
We could be asking, what's the best travel bag for my giant Ericsson phone? Not the question. The question is the next version, the 10-year version, next version of the mobile phone. How will it be different? We have run, of course, we have to in our business those experiments with AI, and we're asking the right questions. We're able to get who are the largest biotech and pharma companies in the world, who are the ones that have commercial products, who are the CMC leaders of those. So we got deep and relatively accurate answers to a lot of identification of talent questions, and then we asked can you populate the next iteration with their photos? It was all over the place. It was like regular, like more than 90% of them had the wrong picture with the wrong name. Like, it was just a complete mess. So
it's back to the source data, right? If you
it's back
Google
to the
somebody,
source
you
data.
get pictures, like 2 of them are yourself, and then the rest are like, God, who knows who these people are?
We have to know, like, we were gaining
You have to recognize them.
confidence at every next question until we get to the picture, and then we're like,
that's not them.
the rest must be completely wrong too. Then we have to verify all of this.
So you can't do without the human intervention at the end.
Someone. Well, a lot of people now are calling augmented intelligence, not artificial intelligence. Augmented intelligence.
I like that, actually.
Makes a lot of sense.
Let's move to a different topic. I want to go back to, I'm constantly worried, and whenever I come here, I'm talking about the generational gap and how we have to find a way to attract and develop talent faster, better. And I made a comment that got a few tomatoes thrown at me, behind my head during lunch. There was tomatoes on the plates, and it had to do about how unsexy manufacturing and supply chain in pharma and biotech is to too many young, high potential folks. I think I might have called it something about oatmeal yesterday, like pretty boring.
Oatmeal with no fruit, I think, is what you called it.
Yeah, it is. It was not meant as a compliment, and it did not land as a compliment.
Not even fruit.
Not even fruit. I was going to say maple syrup, but then that would have given me away as a Canadian.
Like your accent would not have. Just keep going.
French Canadian. French Canadian. What are you doing concretely to attract the top? Not just those who, through their parents, hear about us, but like the person that has a choice between aerospace and X and Y, and no, I'm going to pick biomanufacturing because that's so cool. What can you do? What are you doing right now, and what would you like to be doing differently to attract the next gen talent?
I think we're all opening up our companies to internships, which is just this, I hate to say it, but it's like not very progressive, but it works actually. Anyone who comes into our groups, they just get so energized by the passion of the people that they're working with, people with, from the same generation. And the more we can do that, and the more that we can, go the other side as well. I have a 16-year-old son. I brought him to the NIBRT facility with his buddy, and so seeing and making it more tangible for him, and it was literally a half-hour tour or maybe an hour tour of that facility, and so I think ensuring that we're thinking on both sides, just bringing in, but also what are we doing to bring our students into places where otherwise they may not have access. NIBRT is a unique facility, I think, in the world, where it has all stages of manufacturing, so cool. And it is a training center. They also have a global partners program, so they're establishing global training around the world. So it's a good model. I'm just surprised there aren't more of them actually, particularly here in the US. Training is a big gap. And I think it's the federal system and how it's constructed prevents that type of integrated mindset.
Yeah. I do think the university outreach is a great avenue and sponsor. I mean, because every student at a top university is looking for internships at big companies and looking for co-ops, things to put on their resume. I think the challenge is, and my husband's a professor at a top 10 university, is most of the top talent, they want to go into consulting, they want to go into investment banking, or they want to, if they're really kind of more innovation scientific minded, they want to be an entrepreneur and kind of figure out how to do their own thing, right? And so the traditional scientific route is not, a lot of people go into academics who want to do that. So I think what we find a lot of times, I think, is if we can attract people into kind of the drug discovery angle, who are strong scientific type of talent, we can often move them into other areas because they see that the career path has a lot of openings that isn't just in basic research and basic discovery. But most people coming out like with PhDs will think, I've got to do drug discovery, I've got to be there. Yeah. But then, I have a PhD in analytical chemistry, I ended up being, a director of a QC lab at one point in my career, and it taught me about the last step before patients get our products and how the business ran and how you run a 3-shift operation and labor relations and all these skills that you can build a leadership career around. So I think that might be the place we can most attract, as well as those rotational development programs. A lot of I think this generation likes the idea of seeing a lot of different things, but then ultimately it's around how we move talent within the company once we get them there.
The G Leadership Acceleration Program. 6 months, 6 months, 6 months. Then you decide.
Merck has a program like that too. 6 months, 4 rotations. It's not everybody, but it's called the Manufacturing Leadership Development Program. But hire in people and cohort of like 50 and put them through those paces. Yeah.
I think that all the talent programs, when working with the university, is having those internship type of programs. I think it's not new, but it works, as you say.
It does.
But I think my learning is so much about it's purpose. That's where you need to hook into people, which is you can do into investment banking. Yeah. How many lives will you save? Yeah. Not many. Mm-hmm. You can make more money, but do you want to save life? Do you want to make a difference? I think that's why we get the hook into them. I actually personally believe maybe there's one problem, at least in Europe, before, which is we don't get people into STEM. Yeah. So you don't even have anyone to talk to. So that's one of the biggest issues. We need more. We are seeing it's we absolutely need more people for STEM.
Agree.
So I'm sorry. So explain again. So you don't get people into STEM in Europe. There's no.
It's not enough.
No, no.
Well, there's
Yeah.
no-
It's
no
just going
pipeline
down,
of
down,
talent.
down. If you
Yeah.
look at like
That's very surprising.
most of our locations, just people coming into STEM, it's just declining, slowly declining. It's different in different countries, but in many countries, STEM is not sexy. That's not the thing to do. They go and do other things. So I think we need more people into STEM. Then we will have a bigger population to recruit from, and we can get a hook into them.
I love what you're saying about the purpose, though, because we were talking earlier about purpose being a big motivator for this generation. And I'll tell you, like, when I talk to kind of my peer group who are like in finance, like most of them are like either retired or dying to retire because they're like, why would I keep working? I've made my money, I've done my thing, and they're like, why are you still working? And I'm like, I love what I do. Like, I feel like I'm developing this next generation of leaders. We're bringing medicines to save lives. Like, I am truly inspired by what I do. And so they can't believe I'm not like trying to retire, early because they all retired very young. But it's just, I'm like, it's not about, sacking money into my brokerage account. It's really, I love it. And I love leading a global group and learning about the challenges and working with different people with diverse skill sets to solve these challenges. Like, it's a really motivating place to work. But I do agree, like what you were saying earlier, like how we market it, like biopharma manufacturing, like for somebody to even say that, like that's what I want to be when I grow up. Like, you would never hear that, right?
It's one of the few careers that's always relevant and just gets better. Right?
Yeah.
If if you graduate with an IT degree, I mean, within a few years, you've got to retrain and do something, completely different, probably.
Yeah.
But biopharma development science, one just gets better and better the more years you spend, the more wisdom you have, the more you have to offer. There couldn't be anything more motivating. And I think we need to talk about it differently
I agree.
with our students.
I think that's an industry-wide.
I think it
Yeah,
is.
think.
I think so too.
Yeah.
And when they hear one story, or they have the chance to experience hybrid, or one plant visit somewhere, and they hear of the Keytruda miracle in the early days of the discovery of what it could do, or there's 100 examples of them, or through the pandemic. I was talking to Pam or to Juan Andres or to the and they were telling me what they needed, but at the same time they were telling me where we were. And it was miraculous. And I went back to dinner with my children, and I told them, this is what's happening. They did it in 42 days. The process development from the genome to the first clinical batch at Moderna, 42 days.
You get goosebumps when
I know you do.
It's crazy. And my daughters were also, one of them
think
now
about
is
what
in
the world would be like if we didn't get that. I mean,
Can you
that
imagine?
vaccine in that time, it was unbelievably unheard of, unfathomable. And we would have all been quarantined for another year of our lives, and all these teenagers whose lives got disrupted, and all of these things that we have this mental health burden. It would have been exponentially worse.
100%.
But it must have. I mean, your daughter chose science.
So two of them chose, one is biomed engineering and one is mechatronics engineering, so the robotics essentially as it applies to different industries. And the one that was that finished med school during the pandemic, since she's been a child, she's been talking about being a doctor. She gave us a Christmas card, my wife and I, 8 months ago, and it was thick. It felt thick. And I'm like, Marie, what is this? And she's like, well, open it. It's a surprise for you and Mama. So opened it, and it was 8 letters of acceptation to the 8 law schools.
Oh my goodness!
Wow.
To
that
change
she's-
gears.
And I was like, what are you doing? You've always wanted to be a doctor. And she said, Papa, with my undergrad in applied health sciences, pharma sciences, and a law degree, I can help talent and do what you do. Afterwards, she learned, for her that's how it came
Motivator.
across, is you actually can help multiple companies by doing like Pepper does,
Exponential
but-
kind of impact.
But the fact remains, we until Top Gun the movie came out, being a fighter pilot was kind of cool, but was like something distant. And now it's something very cool.
Well, I think there's a
Biopharm.
diversity point here, though, too, right? Like, so I think people, when they're in the 6th grade, they think of a scientist as an old white man in a white lab coat, right?
Yeah.
And I think,
That's gotta change.
and I think there's a lot of great stuff going on, like going into the middle schools and having more diverse groups of people, women, underrepresented minorities, getting out into the schools so that people can actually see, like, this is what a scientist looks like.
Yeah.
A scientist can be a mom. A scientist can be a baseball team coach on the side with his family while they also are scientists. It's just people think of them as people who just want to squirrel away in a lab and not talk to any other individual, right? And so I do think we have to kind of humanize being a scientist. And there's pharma's had some good campaigns on that, what scientist means, what scientist, but we just need to do better with that. Because because I think, STEM, people who are passionate and wanting to do STEM, like they tend to go into these more entrepreneurial type of roles or small company discovery, which is great, or academics, but we just, we need more of that kind of talent.
I like the way Anya put it, though, I think, which I never thought of it that way, but it is, I don't know if it's the one, but it's certainly one career that only gets better with time.
Yeah,
And you
Relative
only
to
add
the-
more value the more you
can
learn.
build on it.
I think that could be a marketing campaign right there.
Yeah.
Shoot
It's a
for
great
more money.
point.
One of the most surprising, super interesting presentations I've attended, well, it actually happened a couple of times over the last 2 years, were by Peter Mark from the FDA. And somehow my, full transparency, expectations of a bit of a snoozer, I was at the edge of my seat. It was really interesting. Was it his passion? Was it the sentiment of partnership that was different than, it's not no longer the police state, but more of the partner state kind of thing? So I'd love to get your thoughts on where the regulatory environment is headed. Diane, maybe we start with you.
Yeah, I think it's great. So, for me, having kind of come up through the industry, through the vaccines and through the CBER organization, that was CBER's hallmark for the longest time, was that they were scientists and they understood when you came in with questions. And so I think that, maybe what we struggle with right now is because there's so much volume going through the agency right now, is getting that same access and being able to have some of the dialogue that we had before. But that being said, I would say that I'm still sort of blown away in terms of the volume they're managing and how quickly they are trying to get back and answer the questions. So I think, they're doing a really great job also on recruiting on their side to try to keep up with the science and make sure that they're bringing in new scientists that understand the different modalities. And, I think they're also very responsive to the industry in terms of the guidance. And it does take some time, but when the guidance documents are coming out, they're really helpful. And it's becoming the place where industry can start, but then still have those questions and dialogue.
Yeah, I think as Diane was saying, I think we're seeing a tremendous amount of collaboration, particularly with the new modalities that are coming to light and the manufacturing innovations that we're trying to kind of move forward. And one of the more exciting places where I've seen this happening have been the CBER CAT teams and the CDER early technology teams. They're willing to entertain questions around new technology, how we bring it forward. They visited one of our manufacturing sites to learn about continuous manufacturing. It's just a place where there's a lot of dialogue, answering the questions and kind of co-creating the requirements before you send in a submission and then get the questions then, right? And so I think those have created some really positive avenues. Also, FDA is publishing more papers for discussion. And then the other place where I think on the regulatory side that's adding a lot of potential are these collaborative reviews, like the ICMR pilot. So this is where there's multiple agencies all coming together, and when you put in your submission, for example, for a post-approval change, they'll review together and they'll jointly ask you questions. So then once it's approved, it's approved for all of those countries. Through PICS, there's this vision of coming together and doing one inspection and having that apply to all of the countries. So I think when some of our more sophisticated regulatory agencies are really looking to kind of have more of a global presence, that's allowing us to shape the requirements for new modalities and try to prevent kind of the divergence where every single country has its own requirements, because that's what kind of prevents our access to medicine, and it really slows down the ability to adopt these innovations around the world. So I think that this is realized, that this kind of greater collaboration among the agencies is needed, and also with industry, because we don't know the data sets that can best define the products. We're figuring that out. We're discovering that. And so at the same time, we need to do that hand in hand with our regulators so we can together build the data requirements for these submissions and try to do so in the most coordinated way possible, so that some countries are not prevented from getting these medicines, for years and years just because their regulations haven't caught up. So I think there are a lot of mechanisms for this, and I think the industry work groups and the ICH and Reliance, there's a lot of mechanisms, I think, to do this. It just requires attention to it, because if it's left to its own devices, it will diverge, and it will not create an environment that promotes it.
You've put your finger on one of the potential root causes of the increased pressure on costs, possibly. We'll get back to that in 1 second, but before, Anya, understanding how you're in a number one role now, so you oversee the entire end-to-end supply chain at your company. But you grew up in development, unless I'm mistaken, and from that seat, how do you feel the regulatory environment has changed?
So I'll have to say, I've been so impressed with how the regulators adapted during COVID to enable the accelerated authorization of so many products. I mean, that was unprecedented. It happened fast. I mean, really, when we needed it, they responded. I'm seeing post-COVID a regression rather than a continuation of some of those more lenient, if you want to call them that, approaches. And so I do think that continued, collaboration is needed, education. Because of the volume, there's a lot of new staff at the FDA who may not have the seasoned experience that we're used to from the past. One of the big things I think that's missing over the past maybe 10 or 20 years even, we had regulators who joined industry. We need to get to the place where industry is joining the regulatory
It used to be
realms.
so.
Yeah. Because without that, it's hard for them to be relevant. And they can tour facilities and, make connections through the partnerships. But until we actually make it attractive for our peers to go and be part of that community, I think we're not going to move as fast as we would want to move in this new world. And certainly for me personally, in a small company where we're trying to push forward these novel medicines quickly.
How about you, Per, from a billions in assets, multiple plants around the world, commercial manufacturing standpoint, how have you experienced the regulatory changes over the last few years?
Yeah, I think as already mentioned, I think I've actually seen something. We saw a lot of positive movement during the pandemic, very much going to what will the science tell us, what's the right thing for the patient. I think actually what we start to see is people like getting back into the trenches a bit now, and it's like, okay, no, this is like pre-pandemic, we're going to do it the old school way. I think that is not helpful, and I think we together with the regulators need to like push it back to, okay, we could do it during the pandemic, we approved a lot of great drugs through the pandemic, how can we get back there? I think one thing that we are talking a lot about, which is what actually makes it, what's the critical things that we should have in our filings, and we can go back and we see some of our a bit older filings. We have filed so many things, and some regulators still ask for like what's the make of this kind of like container you're using. It's like, but does that, like, what the make? They can't why? It's like, so I think we have a bit to go there.
The pendulum swings
Yeah,
on
it
the
does,
level
it
of
does.
detail that they want or expect or we try.
Yeah.
I remember my very first IND I wrote in 1998 at Pfizer, and we submitted it. I got no questions. I don't know if anyone remembers John Berridge. He was a legend of ICH. Yeah. John came to me. He said, "You didn't push the envelope.
No.
You got no questions."
If you got no
I
questions,
was
you
feeling
weren't
great.
being progressive.
Yeah.
And we have had exactly the same discussion, which is
Yeah.
it's not a success to not get questions.
Yeah.
Yeah.
But
Interesting perspective.
Yeah.
Let's go back to something you put your finger on, but I'd be curious to hear you on. There's a lot of colleagues at the conference that are discussing the. Some are associating it with the inflationary push, the increasing costs, in cost of everything, direct costs and indirect costs, transportation, et cetera, and are discussing the pressures associated with the cost increasing. And so I'll ask you about that directly, but I would like you to comment also on, in your mind, is there a difference between cost and value Is it worth going for a lower cost if there's a potential slight increase in quality concerns? Is it, which is an obvious answer, but you know what I'm asking. Let's start with you, Anya, just because you're looking at me that way.
I think understanding, what we're delivering to patients. If we're delivering a heart medicine, it's not the business we're in, but just, for example, that's going to save somebody's life. I mean, that's a value that you can't quantify.
Correct.
And I think the question about cost and how we manage cost is one which will continue to be a big factor. But I don't think we talk about value enough. I don't think we help our business partners understand it as much as we need to, or even our investors. So it's it remains to be one which I think we need to do more on, and working with patient advocacy groups, really taking a different approach, because the patient is what we want to be talking about, not the investor or the the company stability. If we talk about the patient, I think it makes all the difference.
Interesting perspective. Diane?
Yeah, I guess kind of where I'm thinking about it is, it's a really key problem, especially for the new modalities, because as they come forward, they are going to be initially very expensive. And yet the promise is so strong that I think we've got to continue to have the appetite to work through that. And then I guess I also applaud the companies that are trying to come forward with some very innovative mechanisms in order to help address that, because I think that's necessary. We've got to push through, we've got to get them out there, and then over the course of time, we'll also start to see some of that dropping. But the innovation's so important.
I think we need to start, I like what you said, we need to start with the patients. This is about how can we create access. So that's, if we start at that, I think that will help us to take the right decisions. So it doesn't become like we need to drive down cost. It's like, okay, how can we make these medicines affordable? If we start there, I think that will be a good point. But also, I think I've had a lot of discussions with my teams. We just need to embrace it. You can either sit here and say, it's a problem.
Yeah.
But also, for some companies, if you do this correctly, I think it will be also a competitive advantage, because the people that actually really embraces the new reality that it is more costly and do something about it in terms of driving innovation, driving digitalization, using AI and other technologies, they will win. I think we have seen it look at the automotive. There are one company that is constantly lowering their prices. They're killing everyone else. And they do it by thinking differently. So I think who in pharma will be that company? I think that's the big question.
That's a fair question. Anything to add?
No, I like the point around value, right? Like what is the value in the eyes of the patient? And I do think we're going to be having to invest in these new modalities and technologies to be able to bring them forward, because that's the cost of innovation. And then once we can streamline and make them more efficient, they will become profitable. In the beginning they won't be, but it's the only way to advance the science. I also think this point you originally asked the question around, can we lower cost and quality and those types of things. I think, to me, like in the manufacturing environment, it's all about going after waste, right? There's a lot of waste there. And if you chase the waste, that is the way, I think, to get your streamlined efficiency without sacrificing quality. And then you get to a point where you can keep doing that and streamline the process and get to some cost point. But then after that, it's kind of completely reinventing, right? And just saying, where is the opportunity to do things completely differently? And with the new modalities, there's a great opportunity to invent and do things differently. With older products, it's kind of hard because of the regulatory hurdles around the world to kind of change things, right? So with the new inventions that are going on now and the new modalities, I think we have a chance to innovate tremendously.
It may not surprise you, but you will see tomorrow, if you're still around, that we're going to provide essentially I've taken a bit of a risk here, asking an unrelated to our industry, one of our top industrial psychologists, to run an MRI on our leadership. 98 of us that went through the full process of the full Hogan assessment. So personality traits, overused strengths, otherwise known as derailers, and the values, what gives us energy. And I've asked her essentially to tell us what she's seeing without context, and and then she's going to compare it to the other 1,200 non-manufacturing and supply chain leaders in the industry for which we have similar data, just to see how are we different. But bottom line, one of the things it's going to show is we're not that interested in selling ourselves or what we do or why we do it to the rest of the C-suite. That's not what gives us energy at all. We don't. It's like we found the best way. It's that way. Don't bother me with those discussions. And so when you get to the number one role for the first time, and suddenly your peers are HR and commercial and finance, this is a new audience. They're non-technical. You have to, I'll say it for them, dumb it down a little bit for them to follow you into your manufacturing journey. But that's not in our MRI. That's not in our DNA. We don't like to do that.
But it's so needed.
Yeah.
It is
And
so
I can
needed.
tell you that we make investments, big investments in manufacturing with the C-suite holding hands, and that didn't happen in the past. It is happening because honestly, we need to take the risk so much earlier than everyone else, and that education in advance and helping them understand our business has been really enlightening to, and really it inspires me, because I think our jobs have always been, just get the medicines out the door, get the data for the filings. They're the two things, right? Data and supply. But now it's about knowledge and information and education, so that we make the right business decisions.
Thank you to the four of you for joining this conversation. It was extremely interesting, and you've been very generous with your thoughts and authentic selves. So thank you all.
It's been a pleasure. Thank
pleasure.
you,
Thank you very
Pascal.
much.
Yeah,
It's
nice
been great.
job.
Thank you for having
Enjoyed
us.
it.
Yeah.
You've been listening to a very special episode of Executive Platform's Blueprint podcast series. I've been Jeff Mix. Let's do it again soon.